I know I talk about vision all the time, but I mean that with all sincerity. Our vision, usually we don't have to think about it. Right now, I'm just looking at you, I can look over at Betsy. We don't have to think about it. But for our children, when they get traumatized or they just need glasses, when a child does not have good vision, they don't know it. They're doing the best they can with what they have, right? And we rely on professionals to give us the information to help our child. I am really spoiled because I have professionals around me here in Phoenix. I think one of the best ophthalmologists ever, which is Dr. Cassidy. I know we don't always have to mention names, but I'll mention his name. So it was so nice to hear just from another parent, and that's all I'm offering you to, is when you think you're going to the best doctors, and we don't have to go over who's good, who's bad, but when you need to help your child, it's not a child with CP, it's not a child with a brain, it's not a child with Wolf-Hirschhorn syndrome. This is your child. That's why you're here, for that individual treatment, but it's your child, and you need to know how to help your child. And when you don't have good information, or especially too, where it's like, I can't check the vision, or I don't know what to do, but it was just nice again. So, here's just, what did you think about just the difference of the different ophthalmology approaches?
Yep. So first of all, thank you for actually introducing us to Dr. Cassidy.
Yeah.
Right. So coming here on Monday, our intention was just to focus on therapies with our daughter, and here this week, and then right off the bat you said, hey, you need to go check her vision.
Right.
And
which we have
for the last 3 years. And we had a specialist in down in Dallas, and we've been going to this doctor for the last 3 years, and every single time he says, yeah, she has vision, but she's too young to really really detect if she is able to see, how far she can see, or what her future treatment's going to be. So it was kind of like one of those, just come in every year, every 6 months, and let's check. So we got to Dr. Cassidy yesterday, and honestly, I would say he's probably one of the best specialists that we have seen in a very long time. He is a very genuine person, very humble. His focus really was to not just sit with our daughter and go through all the tests and stuff, but also at the same time walk us through exactly what he's seeing visually, and also come up with a game plan. Now, obviously, since we're from Dallas, he's in Phoenix, there was no pressure to say, hey, you need to come back in 3 months or 6 months, right? He was very open to the fact that, look, any type of questions, if you come to me, if you don't, but here is the plan that I think generally that you should do with your daughter, which is X, Y, and Z. So again, thank you so much for introducing me to Dr. Cassidy, and I really recommend this to all the parents who are watching this, to, even if you don't have a slight issue with your child or needing to see an ophthalmologist, and there's just a little doubt, go see him. He's a great guy.
But also, this isn't like, again, a testimony for Dr. Cassidy. He could examine her. First of all, she's getting glasses, right? We're dealing with strabismus as well as her astigmatism. So the question is right now, with the glasses and a patching program now that she's also getting, will that be enough to strengthen her eyes to bring the eyes out? If not, then there is a question of possibly having the surgery for her. But again, that's a game plan. But to have a child when something is as simple as just glasses to help your child see, versus just letting her exist in her own little body. And again, so a very layman's term of vision, pretend you're saying that this is 5, and every day you teach your child that this is 5. But they're seeing this some days, this some days, this some days, this some days. So 5 is never true, or a ball and so forth, or even daddy. And so that's what it is. So now she's got a fighting chance for her vision to be successful. And if her vision's successful, guess what? So is her reaching, and so is all those skills. So not only is he going to have a game plan for vision, but now it's going to matriculate into movement lesson, OT, PT, whatever you're doing for your child. And that's what I love with that whole treatment. But to hear your child can't be examined, that all I'm hearing is, I don't know how to examine your child, so therefore it can't be. and that's not the way to go.
Right.
So,
Okay.
Thanks.
Thank you.
So, thanks for listening, guys. But if you have a child that has neuromuscular conditions, one of your baseline checks is your ophthalmologist. But if the first opinion doesn't work, sometimes it's the second or third. But if you feel your child can't see you well enough, track or follow, again, you've got help here. But sometimes you need second opinions or third opinions, and they're worth it.
Some questions?
Yeah.
To be
Sure.
more about,
Yeah.
what your experience, because I don't
Yeah.
think we got a lot of your experience. Did you ever, were you thinking of going to another ophthalmologist?
No.
How many ophthalmologists had you gone before?
We've gone to about 2 ophthalmologists, one in Dallas and then one at the Mayo Clinic, and kind of got the same sorts of results from.
Did
from
you
them.
think that something?
No, not at all. Like
Because they said
getting glasses at her age, 3.5 years old, like it wasn't even something we were even thinking about, or even think, hey, that's possibly a treatment plan to help her improve when it comes to her movements, right?
Yeah, because also too, they were told that it was more the damage to the brain, why she
Exactly.
couldn't see.
Correct.
That the eyes were okay. That's where they were going to, was a retina specialist.
Yep.
So that's what they were hearing, where the eyes were fine. But that's just the structure, like the optic nerve and the retina were fine. So parents go, oof. But again, like your eyes are fine, but you seriously need
I
glasses.
need glasses.
Yeah.
I can't drive without.
You can't drive.
She always tells them oh, check your.
Yeah.
Oh, I already went.
Yep.
And there should be more. Always trying to look for that, second, third, fourth
Sure.
opinion.
Yeah, because you never know.
If you can,
Yeah.
obviously sometimes it's just so expensive.
Yeah. But I mean, just again, like we were not even thinking about going to an ophthalmologist. That was the number of checklist things that we have to focus on our daughter this year. Ophthalmologist was not.
Yeah.
And the only thing we would have done was just go back to this guy that we go to just as that annual checkup, right?
And also too, this doesn't have to be on the video, but Dr. Cassidy's sort of like in a strip mall. Like I have a better office than he does.
Yeah.
You know what I
Oh
mean?
yeah.
You know what I mean?
Yeah,
Like
yeah.
he's just in a
Yeah.
strip mall in
Yeah.
that sense. Like a strip, like next to a pizzeria kind of thing.
Yeah,
He's just in a
yeah,
strip
yeah.
mall. So they're going to like children's hospitals.
Yeah.
You think you're getting the ambiance, and therefore
Yes.
you're getting that.
Yeah, like we're going like a retina foundation, right?
Right.
Which is like non-profit organization, top of the line, like rooms, blah blah blah, right? But
Right.
like you're right. I mean, again, very humbling guy, just down to earth. Actually, truly cares about his patient. And when I told him that, he said, "Look, that's just how I am. That's just my personality.
Right.
Like I like to, no matter if they are going to be my future patients or existing patients, or this is just a one time, I want to educate you guys to make sure that you have a plan for your child."
Yeah.
So, yeah,
Very good.
thank you.
Why he won't do this is driving me nuts.
Yeah.
Very
Let's
busy
tag him in
again.
there.
I've more than tried to can you just sit down? Can I ask you the 5 questions when they hear your child's too young to be examined?
Yeah.
Or if there's nonverbal, they can't respond, they can't be, you
Yeah.
know. So,
This doesn't
yeah.
happen. Okay, thank you so much. I think